Philanthropy. It's all about giving to the causes that matter to you the most and making a real difference in the lives of others. Humanitarians understand this is not an activity reserved only for the wealthy. In fact, being a humanitarian is all about living your life with purpose, on purpose. It becomes a way of life and a way to truly experience living life to the fullest. Everyone is born with the ability to be a humanitarian. This podcast is for humanitarians, by humanitarians. We'll learn from guests who will inspire, motivate, and help you step into living your best life with purpose. My name is Nancy Landa. Welcome to Cause Talk Radio. On today's show, we are continuing the roundtable discussion with my two illustrious guests, Osas and Terry Lynn. Osas is incredibly passionate about people, society, and technology. He is an author, speaker, translator, ambassador, co-founder, and COO of multiple companies. He has built systems together with partners across the globe and has trained both young and old across 15 African nations. He is on the verge of rounding off his graduate program overseas. Terry Lynn is a mentor, a coach, and an adopted mom to many young people in Africa, as well as other places around the world. She is on the board of directors of Amina Africa, a humanitarian outreach assistance program for African Christian leaders. Terry Lynn has an Associate of Science degree in electronics engineering and spent nearly 8 years in the field of electronics and field service. She currently resides with her family in North Carolina. Welcome back, Osas and Terry Lynn.
Yeah, thank you very much, Nancy, for having me today.
Thank you, Nancy. Thank you, Osas. Yes, it's a pleasure being here today.
Awesome. So this is part 7 of our 10-part series entitled Ignitions for Emerging Global Challenge. Our topic today is the healthcare shift. Perhaps one of the very few positive things that has emerged as a result of COVID-19 is telemedicine. Osas, what is telemedicine and where does it fit in within the healthcare arena once lockdowns and social distancing has become a thing of the past?
All right, telemedicine is an aspect of medicine where medical healthcare services is being delivered either through a web-based or online or app-based, as the case may be. And many persons are not be able to explore this part of this medicine because of like some other part of the world, power, internet services, and all that. But during the COVID-19, where social distance became a thing of the day, where people couldn't meet their loved ones and their health were in danger, telemedicine became a panacea for one to get back to the normal way of doing things. The reason is because telemedicine creates that avenue for people to get to healthcare services that they want, even in the midst of social distancing or even in the lockdown. So it is a beautiful phenomenon or aspect of medicine that is yet to be explored. But we want to encourage our audience to look at it in this direction. But there are so many apps that's already flying on the iStore and the Android store, Google Play Store, where you can actually just download and you have an interaction with a consultant, a physician who can actually assist you wherever the place where you are. So it is a technology that takes away distance. Distance is not a barrier with telemedicine. Distance is not a barrier. Having a transfer of a medical record is not a barrier. Having access to quality health services is not a barrier. So it is something that have come to stay. Thank God for COVID-19. It has made it become very popular and made it become so much important for people to also run to. And I think it is good that our audience also know about it, so they can also utilize some of the services that is being rendered by all these telemedicine a software that is available within our space.
Terry Lynn, how do you feel about that?
Well, it's heading in that direction. There's definitely there's pros and cons to that. I think it needs, there's going to be times needed to perfect it. Also, it's in the stages of just really just starting, because several states here in the United States even don't have the capability, or they don't have the availability of the app and even working in over phones with doctors. It's a great concept. It's a great idea. It's saving people some time. It's getting doctors to be able to continuously be paid and keeping them in the field of their expertise. And so I feel like it's a wonderful, unique opportunity to make the best of it when it really could be something not so good. I think it's able to reach probably a lot more people. So I think when we take this and turn it into a positive instead of a negative, there's great potential to help people all over the world. It's still growing and expanding, and I think we're going to be seeing it more and more everywhere. It's just kind of the new trend of how medicine is going, how people are now wanting to be more proactive in their healthcare. So, yeah, we can turn this into a positive and not focus on the negative side of this.
Sure. Well, there's the efficiency of it.
Right.
The timing it takes for a person to put a loved one who is sick in their vehicle and drive them to the doctor's office, or drive them to an emergency room, or another type of healthcare office. They can access, a doctor from home. And it's kind of like the new form of home visit. Back when I was a kid, my doctor, my pediatrician, came to see us at home. That's just the way it was back then. The doctors made house calls.
Well, it's heartbreaking when we're in the midst of the pandemic that, you would drive your loved one to a hospital and you couldn't even be in there with them. So right. You had no idea what was going on. You couldn't be their advocate, and it's scary. It's causing a lot of fear, and really that to me was causing several health issues because of that separation and that anxiety that occurs.
Right.
And if you have to, being able to do this telemedicine and going in this direction saves. So I think it can save so many more lives.
But then, there is something to be said for the human touch, something telemedicine can't really provide. In what instances would you say telemedicine would not be a good fit for providing the best health care?
Well, for me, I think it's, I'm experiencing it myself, actually. If you have wounds that are needing attention, and the only way to get that is you've got to go see a doctor. But this is one of the things that telemedicine can actually help, because the doctor can say, based on your symptoms, based on everything I see, through this tool, I'm recommending you go to the emergency room and go ahead and get it taken care of, or go see your primary care doctor, and then be able to go in that direction. And this is without anxiety. You have somebody else you're talking to on the line who is directing you in that way, and you can be prepared. So there are definitely instances where you've got to go and get the attention necessary one-on-one with the doctor.
Right. So, Osas, what are your thoughts?
Yeah. In everything that every technology that comes does have its own advantages and disadvantages. we as entrepreneurs will try as much as possible to look at those advantages and see how we can make a business out of it. So it is something that is evolving. So like that challenge of having an interaction with a doctor, with the help of augmented and visual reality, you can actually have a true, like a visual reality of the kind of attention that you would have loved to get from the doctor that can actually assist in that area. We're not also disputing the fact that sometimes you also need medical attention, but what telemedicine is trying to do is to cut costs, is to reduce the time that people spend, because we are seeing a lot of people who die on their way to the hospital, and because of some prescriptions that some person were trying to give just to stabilize the person without from a professional consultant, and the person couldn't make it to the hospital. So to reduce that, wherever you are, you can have such services. Another part of the telemedicine is where we have the telelogistics, the telepharmacy, we have the telelogistics, where whoever that needs medical attention, you just for you to make an order, and immediately you are already seeing yourself in an ambulance. I will take you to the airport, who will fly you directly in a private jet to whatever destination that needs your attention. And this is something that we can actually get from other the normal way of doing things. And also for those that also want to, maybe after meeting with a doctor through the video call, the doctor made some prescriptions on the drugs you want to take. You can also order through with the help of Google Mapping of some specialized pharmacy close to your neighborhood, where you can go and pick those drugs. And if you don't want to also pick those drugs, you also have a drone that can deliver these drugs to you. So telemedicine encompasses a lot of things. Like I said, some of the challenges that people are saying, we as business men, we are looking at how we can leverage on those advantages so we can make a business out of it. So which we're already taking active steps in solving. We know we're not yet there, but I think that telemedicine is going to come in a form that people will be saying, wow, especially when it comes with the visual reality and the augmented reality, where some of all these advantages that is being seen around telemedicine can be reduced, so that people, there's nothing as being just like what Doreen talked about. Even at sight of the doctor, you're already getting frightened, and that can even compound the problem that you are having. When you are at your home, at your own convenience with your family around you and all that, you could actually talk to a doctor through a video call, and whatsoever thing that you think or whatever challenge you're having, you can actually get it done. And you also need further medications or a form of treatment. You can also be recommended close by, instead of you going for a far place because of you want to get some medical attention, which sometimes might not be so ideal, because not everybody who is sick can actually get to the hospital. Some persons, before they get to the hospital, they're already dead. So to avoid such, telemedicine is a good way, a way out of this.
Okay, so Osas, how does virtual reality and augmented reality fit in with telemedicine? And I really don't know what the difference is between virtual and augmented. Can you kind of explain that?
All right. Virtual reality and augmented reality, they are related. One just precedes the other. The first stage is virtual reality, and while the advanced stage is augmented reality. So virtual reality, just like the way you have that same feeling when you go and meet a doctor, the virtual reality and augmented reality will create such feeling in an environment, a controlled environment, so that whatsoever medical challenge that you are having, with the help of the visual doctor, who is just for you, just like when a child uses this headset to play some game, which is a VRO, a game set. They have the same feeling, like the child is trying to if it is a fighting game, trying to fight the other opponent. You see the child having the same effect that you normally have even in real life. So that is what augmented reality, visual and augmented reality does for you, which can also be used in medicine, and it is something that it has been tested and it is already working, because it's just all about simulating an experience that one would have actually gotten, so similar to real environment, so similar to the real world. Why the augmented reality is just an advanced part of visual reality, where you now have a computer generated perception of some information or some ideas, where so many things are being put together in terms of the audio, in terms of the sensory, which are what the brain uses. So augmented reality will do all of that for you. So it's an arm of that supports the visual reality. Visual reality will create that simulated environment, while the augmented reality will look at other areas so that it will look so real, even in the sight of people. And that is what it is being used, like also the composition of robotics when it's being used in medicine, which we have seen a lot of people who have gotten advanced medical operation through the use of robots. They use some of all these things to check signals, to see how the body will react and all that, so that whatsoever challenges that the person is facing, there will not be mistake. That's one other advantage of the use of visual and augmented reality. It reduces every element of error, every element of human error, because these are working with artificial intelligence power system, which composes of algorithms, which have already been read. One of that data that be collected, and it's simulated into an environment where people can actually have the same feeling, even in the real world. And when you have that can do a lot of things. So it is already being used in other parts. The third with game is already going into the medicine. So that is the reason why we're talking about it, how it is being used in telemedicine, and it is the future of telemedicine we're talking about. Not a tele-healthcare services now. Talking about telemedicine is the future of it.
Okay, Terry Lynn, your thoughts?
Well, we a lot of times, let's just kind of maybe see if we can be relatable here in regards to what Osaz was saying. And many times when we go to a doctor's office, and I'll use an example, chiropractor's office or a specialist office where they specialize in pain relief. They're using virtual replays, videos, to help people see what it is that they can do for them and how those affect the body, and what's going to come out of procedures that they are possibly using or can use to help give them relief. Okay, so with that, virtually, the ease that someone can be made aware of what's going to be happening in a procedure, to be prepared ahead of time, I think that is wonderful. And those are part of the discussions.
So that kind of sets expectations.
Right. Medicine could be headed, and would be wonderful to be able to be prepared ahead of time. And also, but the other side of things is, and I've said this always, just be cautious of AI, because to me, artificial intelligence can be used poorly and negatively, and be not so wonderful for the outcome that we are seeking.
It kind of reminds me, and I hate to cut you off here, but when I think about the AI element, we've all been on these phone calls or chats online with an AI robot, and they are programmed to say certain things, and that's the extent of their, ability. If you throw them a different bone, they don't know what to do with it, and it's frustrating for the end user. And if telemedicine includes that kind of thing, it's going to turn a lot of people off.
Well, the other side of that is, okay, are they going to start injecting something into people that's going to, move in that direction to have access to everything, every part of your body's functioning?
No, we don't want that either.
We don't want that either. So This is the caution I'm throwing out here, is that that's an intrusion, and that is control, and that's not what we're looking for. We're looking for something positive that can help people survive sooner, and it's not all in our control. We just have to do the best that we can do with what we're given and use them as proper tools.
Absolutely.
And really keep it on the positive side. So, I'm experiencing it myself with being able to see these virtual videos play and explain a process that I might be going through. And, it does set you at ease. I mean, so someone could, the silent killers are blood pressure and blood sugar, but, especially blood pressure. If someone is so filled with anxiety and they're already dealing with that issue, and they go into a situation where they're not prepared, they don't know what's going to be happening, and they are filled with anxiety, like Osa was saying, many times they can just even die on the way to wherever they're getting their care. So we just need to, I think, make sure we're staying on the positive side of this and educating and staying in the movement of what the future is holding. And I think that's the way we can approach that.
Okay, so Terry Lynn, so many people have lost trust in the healthcare system, as so many have been, lied about everything. So do you think this distrust will keep people from using telemedicine, or do you think that they will prefer it to going and putting themselves in the hands of, say a hospital or a healthcare worker physically?
Well, I think that it's going to help people that wouldn't go to a doctor. I think that they're going to be more apt to say, maybe I can make a phone call and schedule the Zoom, meeting with a doctor, and that would be, getting to the bottom of this quicker. And because they really don't want to go, they don't have, again, either the means to be able to get there, or it's really far away. Hours we're talking about to be able to get to the proper medical care. And if they can get online with someone, that's a huge difference. That's something that can make a huge difference for family as well as the person dealing with the medical condition.
Right. So do you think the trust issue will be helped by the telemedicine? I think so.
Yes, I think so. Yes, I think it'll be greatly helped. And again, we're also going to be asking the doctors on these programs. They're going to be taking their time. I mean, these days, you go to the doctor, and this is the other thing that's very disturbing. They have 15 minutes to come in there and spend with you. I'm sorry, but what if you need 30 minutes?
Right.
That doesn't happen. Whereas I believe when they schedule these Zooms in a Zoom meeting, you can request the amount of time you think you might need, or they have it already scheduled as far as their time is going to be maximum of 30 minutes, and 30 minutes can cover a lot of things. I've experienced it, but 15 minutes is, oh, hi, how are you? What's been going on? What's changes you got? And And some places it's 5 minutes. Can you believe that?
I know.
5 minutes.
And you spend more time in the waiting room waiting to see the doctor than you actually have time with the doctor.
It's gotten out of control. Yeah.
I think that most people are going to embrace telemedicine for a number of reasons, but saving time and being efficient. I mean, you could be anywhere. You know, you wouldn't have to take time off from work to go see the doctor. You could do it, you know, during a break at work, right?
Yes, absolutely.
So it's just more efficient use of time for both the doctor and the patient. Osas, what do you think?
Yeah. It comes with a lot of advantages. One of them is you have the opportunity to even select any doctor that you want to talk to. You want to book an appointment with. So, before you book an appointment, you can go and check about the person's profile to see the cases that he has handled and everything. So at your own convenience, you choose. Yes, you paid for the services, and not in that case where you are going to be paying the healthcare officers, and you need to waste a lot of time. Sometimes they might not have time for you. This one, you can choose a time that is convenient for you. Talk at any point, even while you are away. You're not in the country. You can talk. You can monitor your health state. Because that's another thing again. Because once people go to the hospital, most times they don't go back again till when they are sick. But with the help of telemedicine, where you're able to give regular information or save regular health records of whatever thing that is happening to you, you're able to see the trend. Okay, this is what you've done. These are some of the tasks you've not done. This is what you have not done. At that time, you're able to maintain. Take for instance, if you met with the doctor and you're looking at your blood sugar, and after giving some medicine, and maybe it became better, you might not see the need to go to the hospital again. Not many persons who just want to go to the hospital when they are fine. But with the with the telemedicine services, you could actually book an appointment with a doctor, and the doctor will ask you how you feeling now, even when you are still fine. So then there will be a rapport between the patient and the doctor, which you don't usually see in the healthcare services. And whatever thing that the doctor just tell you, even while in the hospital, you might not be able to verify it because you feel that they know everything. But with the help of telemedicine, immediately a prescription is being given to you. You can easily just check through the telemedicine catalog or directory to see how this drug or this prescription can be of help. You can also see the advert. You can also discuss with the doctor that, don't you think, or this is what I find out. The doctor will also explain to you further. And thereafter, you can also be having your own homemade healthcare services, which you can actually use to take care of yourself. So it comes with a lot of opportunities, it comes with a lot of advantages. It's just for people to embrace it and know that it will definitely help people. And the advantages you have over disadvantages are more. And anybody that feels that will not be able to embrace that means if you are a physician, soon nobody might want to renew your license because you are not digitally inclined. Most of the clients want to talk to their doctors online. Nobody want to come physically because of convenience. The world is getting so busy. Not everybody have that luxury of time to go and spend. And people want to also maintain their health. So telemedicine is in the future, and it is good that we embrace it. Our audience to embrace it. Everyone in the studio should embrace it because it has a huge opportunity for us.
You brought up a good point that I hadn't thought about, and that's the follow-up. You know, if the doctors have more time to spend now because they're not, because they have more time because they can see patients on a more efficient basis, then follow-ups would be just as easy. So that's really cool. So, Osas, tell me, how can my listeners reach out to you?
Okay, listeners all over the world, you can reach out to me through flagclinic.com, flag like Norman US flag clinic, clinic.com, where you're able to even have access to these telemedicine services. Because Flag Clinic have an aspect of telemedicine services where some
So Fly Clinic is a type of telemedicine, correct?
Oh,
yes.
Oh, there you are.
Yeah. So you can have access to medicine services, which can actually help you through flagclinic.com.
Okay, awesome. Terry Lynn, how can my listeners contact you?
The best way to contact me is through email. And that's at T as in Terry, Lynn, LYNN .hope@gmail.com.
glyn.hope@gmail.com.
Yes.
Okay, awesome. Great show today, Osas and Terry Lynn. Thank you both for being here. I've really enjoyed this series so far and can't wait to get to our next one. Osas, do you have any final thoughts before we go? Can you tell my listeners how Flag Clinic works and how it can help them?
Okay, Flag Clinic is a mobile-friendly application where people all over the world can have access to top-notch healthcare services, especially those that have mental health issues. So we also have a part of Flag Clinic where that offer telehealth services, not telemedicine yet, telehealth services to people around the world. So you can actually just go on Google and look for flagclinic.com and book an appointment so you can get in touch with us here.
Right, and that first consultation is free, correct?
Yes, it's free.
That's awesome. Terry Lynn, what are your final thoughts?
Well, thank you, Nancy. Okay. Well, I think that we have really covered a wonderful topic here, an issue that we should really work on as we move forward. Providing the resources and easy access to the sources that Osas was speaking of, and also having that be a part of the directive for people. And I think this whole thing has brought people back to their being proactive in their own health. And when they see the seriousness of this, and they can have access online to get advice, even from a doctor, that we need to make the resources available. If they're prescribed drugs, that they can go online and they can research the drugs and they can actually see what the side effects might be, how they interact with other drugs that people are on. This is an important part of being proactive. This is very important as part of the education as well. So I really appreciate the time today, and appreciate Osas and you, Nancy, for bringing us together to cover this topic. And so there's a lot of improvement that we can work towards moving forward.
Well, I appreciate both of you. Well, folks, if today's topic has motivated you to help or get some help, please reach out to Osas or Terry Lynn. Their links are provided in today's show notes. Thank you so much for listening. I hope you enjoyed this episode and were inspired to begin living your best life with purpose. Be sure to click the subscribe button or go to callstalkradio.com and join our mailing list to be notified first when new episodes are available. For more information about anything on today's show, head on over to callstalkradio.com. Click on the podcast link to locate this episode's post. There you'll find all the information covered on today's podcast, including links for easy navigation.